372. Now, before I leave the stage, I want to introduce a gentleman to you. After 30 years of working with the Federal Reserve Bank of Kansas City, he retired as a vice president with responsibility for supervising and regulating state member banks and bank holding companies in the 7th State 10th Federal Reserve District. After moving to San Antonio, he volunteered as a state health insurance program benefits counselor with ACOG from 2006 to 2021. He has been a member of the Bear Senior Advisory Committee since 2012, serving as the chair in 2016 and 2017, and as chair and a member of various subcommittees during his tenure. I'd like to present to you Mr. Jim Johnson.
Okay. I won't talk to you about banking today. I'll try to talk a little bit about Medicare. You probably look at the first slide, and some of you might say, well, he doesn't even know how to spell his last name, but it is spelled without an H, J-O-N-S-O-N. I have no idea what the total, or didn't know what the total experience was going to be here today in terms of people, so I'm not going to start with the very beginning, but let's at least take a quick look at the 4 parts of Medicare as a basics. A, B, C, D, that's what it is. Parts A and B are what they call original Medicare, because this is what started back in 1965 when LBJ flew to Independence, Missouri, where I actually lived for a while, and he went to the Truman Library and he signed the Medicare bill into law, gave the first card to Harry Truman and his wife, the second one to his wife, Beth. Then we have Part C, and this came about during the Clinton administration when the Balanced Budget Act was signed in 1997, and what it did was it actually provided to private insurance companies the right to step in and take over some of the Medicare benefits. They still had to follow what Medicare proposed, but they could do it as a private insurance company. They called that Medicare Plus Choice at the time, but then in 2003, during the George W. Bush administration, they signed what was called the Medicare Modernization Act, which created Part D. Prior to that time, there was no prescription drug coverage. And it also changed the name of these private plans to Medicare Advantage plans. And so we have A, B, C, and D. Well, did they leave the right clicker? Maybe it's this one. Original Medicare is a federal government-administered program, and it covers inpatient hospital care, medically necessary doctor visits, outpatient services, and some preventive care. Most beneficiaries do not pay a Part A premium, as many of you probably know. As long as you worked 10 years and paid the Medicare, or paid the tax for 10 years, then you're entitled to no payment. Also, if you are married and your spouse worked at least 10 years, you have at least 40 credits, as they call them, and you don't have to pay anything for Part A. So it is free for most. But also with Original Medicare, there is some cost sharing. There is a Part B premium, which is $185 this year, and for what it's worth, the estimate is it's going to go up to about $206 next year. And there's a 20% co-insurance after you meet your Part B deductible. And that Part B deductible is $257 this year, and that's probably going to go up next year too to something, maybe, I don't know, $280, $288, something like that, maybe higher. These are just estimates. Also, with Original Medicare, there is no out-of-pocket limit. If that's all you have, then there's no cap on things, and you could pay thousands, 10,000s, or whatever dollars if you don't end up with something to supplement this. There's a provider choice. You can see any doctor or hospital that accepts Medicare anywhere in the United States when you have original Medicare. But you need to purchase a separate prescription drug plan, Part D, in order to cover prescriptions. And you can buy a Medigap policy to help cover these deductibles and the co-insurance. Now, that $185 premium that's up there that's going to go up, that's what it is for most. About 7 or 8 or maybe 9% of the beneficiaries in this day and age pay more than that because of IRMA, which is the Income-Related Medicare Adjustment Act. And you can pay 140% of the base premium. Some people that make over $500,000 a year are going to end up paying $400 or $550 a month for Part B. So the pros to original Medicare is you have provider flexibility, you have network access across the United States. You can go to any doctor across the United States or hospital that accepts Medicare. As far as cons, there is no out-of-pocket annual cost limit, and you do have to buy a separate drug plan. Medicare Advantage is a Medicare-approved alternative to original Medicare. It's offered by the private insurance companies, like we say, that have contracts with the Medicare program. They're bundled plans. They'll wrap up Parts A and Part B that we looked at into this, and normally 97% of them are going to have Part D coverage all in one plan. There's some extra benefits, as you see with the TV ads and so forth. Like many of them are going to provide dental, vision, hearing, gym memberships, and so forth. It's basically basic, although some of them have gone up a little more. Like the dental, oftentimes it's simply maybe 2 visits a year, 1 cleaning. But there are some extra benefits that are there. Some of them even will pay part of your Part B premium. And some of them will provide some other things, even food delivery and things like that you may see, but you have to be qualified. When you see that, that doesn't mean that you can just get it and have food delivered unless you're really low income or have some means of having that necessity. There is cost sharing. When you have Medicare Advantage, you may pay a monthly premium in addition to the Part B premium. You're going to have co-pays, you're going to have deductibles, and there's co-insurance there. One thing about the Medicare Advantage plans nationwide, there is an out-of-pocket limit. They have an annual limit on how much you'll pay for covered services. And this year that limit is a max of $9,350. Some of them may have a limit of $4,500. Some of them may have a limit of $5,200. When you hit that limit for that calendar year, you don't pay anything more out of your pocket. You roll over to January, it starts all over again the next year. That $9,350, everything else we talk about is going up. That's actually going to drop to about $9,100 next year. Exactly why, I haven't figured out yet. Provider network. Most of the plans will have a network of doctors and providers that you must use in order to avoid paying more for non-emergency care. Emergency, most of them anymore will pay for that. Referrals. Some plans may require referrals before you can go see specialists. In other words, you may have to go to your primary care physician and say, can I go see a specialist? There are some that do not. There are 2 types, and we'll talk about those, of Medicare Advantage plans, primarily HMOs, health maintenance organizations, and PPOs, preferred provider organizations. You normally have more freedom with the preferred provider organization, but you may end up paying more for that plan. The pros for Medicare Advantage, without the supplemental or separate prescription premiums, the cost may be less, and you do not have and does not have an out-of-pocket limit. The cons, limited provider networks, potential for higher costs for out-of-care network, and it may require prior authorization for certain activities. Well, a quick look at Part A. And these are things that have to be covered by both original and Medicare Advantage, because the law says that the Medicare Advantage plans have to cover basically what original Medicare covers, only they can do it in different ways. But they all cover inpatient hospital care. If you're admitted to the hospital, it'll pay for a semi-private room. Either you or friends may know people that get in and they have a private room. Well, if one's available, they'll do that. But the basic guideline says pay for a semi-private room. Skilled nursing facility, Part A covers for that. Not long-term care, not nursing homes, but skilled nursing facility. If you've been in a hospital for at least 3 days and your doctor says you need to go somewhere for occupational therapy or physical therapy or something like that, even certain wound care that needs to be healed a different way, then skilled nursing facility is covered by Part A. Home health services that a doctor determines are medically necessary, and all Part A, both original Medicare and Advantage plans, will pay for hospice care. Now, with original Medicare only, there is a Part A deductible. If all you have is original Medicare, then there is a $1,676 deductible when you're admitted to the hospital. Not emergency room, but if you're admitted to the hospital, you pay $1,676 for each benefit period after you're admitted. If your benefit period stay extends beyond 60 days, then there are actually co-pays. And you'd pay $419 a day for days 61 through 90, and $838 a day for 91 through 150. And that 91 through 150 is actually a lifetime benefit offered only one time. Now, benefit period means it's 60 days. So if you were to go in the hospital on January the 1st and you come back out on February the 1st and you go back in before February, at the end of February, you're still in the same benefit and that deductible wouldn't start all over. But if you were to go in on January the 1st and come out on February the 1st and not go back in until July, then you're in a different benefit period again. The skilled nursing facility, you pay nothing for days 1 through 20, but you would pay $209.50 a day co-pay for days 21 through 100. And all these numbers change every year, and they go up, they never go down. Well, for both original and Medicare Advantage, what does Part B cover? It covers outpatient care, doctor visits, that's what we normally think of, hospital emergency room, home health services, durable medical equipment like wheelchairs and walkers and things like that, laboratory tests, rehab services, palliative care, including hospice, of course, and other medical services are covered by Part B. And those are also covered by Medicare Advantage plans. They're just covered in a different way, and we'll see an example later on. Well, with original Medicare only, you do have a Part B deductible. It's $257 this year, as we pointed out earlier. So basically, the first time you go to a doctor in the middle of the year, let's say it's a $307 visit to make it easy, you're going to pay $257, and then you're also going to pay 80% of that additional $50 that's on there. And so once you do that, the next time you go to the doctor, if you have no other insurance, you're basically going to pay 80% each time, or 20% each time, and Medicare will pay the 80%. Preventive services, there are some things, particularly like tests that you can take, PSA tests for men, women examinations, certain types of shots that you go to the pharmacy and get flu shots, and the COVID shot, we hope you still can, and other things like that where you don't pay anything. It's 100% paid by Part B. And you can get a pneumonia shot once every 10 years. So preventive services and certain screenings and so forth are covered by Part B with no deductible. Well, in order to cover the gaps that we've talked about with original Medicare, you may consider buying a Medicare supplement policy. These are sold by private insurance companies. Many of them are the same companies that sell Medicare Advantage plans, United Healthcare, Aetna, Cigna, so forth and so on. But also with Medicare supplement plans, you'll find them sold by State Farm Insurance and some other insurance companies that don't get involved with Medicare Advantage plans. They're known as Medicare supplement insurance. They're also known as Medigap. Something you need to buy when you're first eligible. So if you're on original Medicare, you're thinking about going to original Medicare, this is something you need to pay attention to. In 37 of the states, they follow the Medicare guideline, which says that you only have a 6-month trial, a 6-month time period where you can buy a Medicare supplement plan and be guaranteed that you can buy it and not pay more than somebody else would. And that period begins when you're 65 years old or older and enrolled in Medicare Part B. As some of you may know, if when you turn 65, if you're eligible for Medicare, you want to take Part A. If you're still working and you have insurance through an employer, you can postpone Part B because you don't need it. You want A because even a policy that an employer may have is going to have some deductibles. If you go to the hospital and you have a Part A, it'll pick up those deductibles in most cases. But the period in which to buy a Medicare supplement plan begins when you have A and B. Even if you wait till you're 68 or 69 and retire, lose your employer insurance, and you sign up for Part B, then you've got A and B. You've got a 6-month time period where you can buy a Medigap plan without being subject to underwriting. I mean, regardless of your health, you'll get it, and you will not pay more than any other 65-year-old or 67-year-old if that's when you get Part B and you decide to get one. After that, you're subject to medical underwriting. Now, that's 37 states. You know, some of them are more liberal. There are some states, New York as an example, where you can buy one anytime and you're not subject to underwriting. You can switch anytime you want. You know, well, you're subject to underwriting, but you can buy one. You can't be denied. But you'll find that if a Medicare supplement plan here is $100 for a woman, as an example, that same plan in New York when you turn 65 is probably going to be $250 or $300. Now, there is an instance of a trial right. When you first go on Medicare, if you decide you want to try Medicare Advantage plan, you can get that Medicare Advantage plan. Then you have a 12-month time period. And this is only when you're 65, if you sign up and you have A and B. If you're 67 or 68, you've been working, you retire, and then you get your B, you don't have this trial right. But if you're 65 years old and you go on Medicare when you're first eligible during the 8-month time period, you have to sign up, or the 7-month time period, then you can go for up to 12 months and decide to drop that Medicare Advantage plan, go to original Medicare, and then you still have a right to buy a Medigap, guaranteed right. But that's the only instance where you can do that. Otherwise, you've got only the 6-month time period. Well, when we're looking at the Medicare supplement plans, and if I said Medicare Advantage, or I was talking about Medicare supplement, I'm sorry. The Medicare supplement plans, they come in all kinds of letters, A, B, there's the plan C, there's a plan F, so forth and so on. But the two most popular ones today are G and N. And this sort of shows the things that are covered, and I kind of overlaid inside so that it would relate back to what we've already talked about. Medicare Part A, coinsurance and hospital costs. If you have a Plan G or Plan N, then that pays for that. That's the $619 a day cost we mentioned and the $837 a day cost. We had to pick it up and pay for it. The 20% that Part B doesn't cover, when you have a Medigap, it will pay for that 100%. Pays for the blood for the first 3 pints. If you can't get the blood for free, if you have to pay for it, this will pay for the first 3 pints. Normally, you don't have to pay for it. It pays for Part A hospice care coinsurance. If you have to go to the skilled nursing facility, if you recall, you are in there for free for the first 20 days. After that, there was a $209 a day cost. If you have one of these plans, it will pay for that. Also, the Part A deductible that we mentioned, the $1,676, the Plan G and the Plan N will pay for that. They won't pay for the Part B deductible. Plan F pays for Part B deductible, but the only way you can buy a Plan F anymore, Plan F does everything that G does except it pays that deductible, but you can only buy that if you were born before 1955. Part of the reason that the government, Medicare, decided to stop that was because they found that people that had Plan F, and I had one originally but decided to change, when they had a Plan F, they would go to the doctor more often, go to the hospital more often. It's only a joke in a sense, but I think they used the phrase that people with hangnails would decide to go to the hospital. And so it was causing the companies to pay more money, Medicare to pay more money, so they dropped it so you can only buy one now if you were born before 1955. One of the things I point out, and then you see the plan in, the plan's a little cheaper. I can't tell you exactly, but in Texas, I mean, there's a lot of companies that sell Medicaps. Normally what you're going to find, maybe on average, when you're 65 years old, a female that would buy a Plan G would probably pay about $100 a month. A man would pay about $115 a month. Males pay normally about 13% more for each level, at least this year. And then, of course, the price goes up every year, at least every year once. One of the things I highlighted at the bottom, I put that on there myself, because a lot of people talk about, well, what plan do you have? And I don't want that one because I don't think they're a good company, et cetera, et cetera. Medigap plans make no decisions at all. When you go to the doctor, you may have to present your Medicare card and your Medigap card. They want to see that because they want to know how they're going to be paid and whether you owe something right there at the desk when you leave. But Medicare insurance plans do not make any decisions. When you go to the doctor, they'll send that bill to Medicare. Medicare looks at it. If they think it's medically necessary, they'll pay for it. They send it on to the Medigap, Medicare supplement plan, and they'll pay the balance. But they do not make any decisions. The Plan N, which is quite popular, which, you know, maybe instead of $100, you might be able to get one for $83 or $84. It's becoming very popular, but it's very much like G, except you may have a copayment of up to $20 when you go to a doctor's office and up to $50 for emergency room that you have to pay out of your pocket. But it is becoming very popular. Plan G is the most popular plan now. N's moving into second place pretty quick. Plan F used to be, but it's dropping out because new people can't get on Plan F unless they were born before 1955. Now, you may not need a Medigap plan in some instances. If you have TRICARE for life, as an example, retired military, that serves as your supplement. You have to have A and B, though, to use TRICARE for life. If you have TRS retirement insurance, you may have their insurance, which is a Medicare Advantage plan, but it's better than most of the Medicare Advantage plans you can buy on your own. If you're a federal retiree and you have FEHB coverage, you may not need parts A, and sometimes you may not get B, but it's wise to have B, because as you get older, you'll find there's some deductibles there, even when you go to the doctor, with the government plans that you may have to pay out of your pocket. If you have some other former employer retiree insurance that will cover Medicare deductibles and co-pays, and of course, if you're on full Medicaid, or if you have a Medicare savings plan, you're a qualified Medicare beneficiary, you know, then you don't have to have one. In fact, if you're on full Medicare or Medicaid, an insurance company cannot sell you a Medigap policy. And I point out once again at the bottom, regardless of what kind of retiree health insurance you have, if you qualify for free Part A, you want to take it. You want to take it when you're 65. What about Medicare Advantage plans? It's the alternative to the original Medicare insurance program. It's offered and administered by the federal government. It's offered by private insurance companies. Medicare Advantage plans have to be approved by Medicare to provide and administer benefits for their members. They also have to be, insurance companies that sell the Medigaps or anything else have to be approved by the state insurance department to operate in that state as well. The Medicare Advantage plans cover the same services as Part A and Part B, and in most cases, 97% of the time, prescription drugs are included. There's more predictable co-payments, deductible amounts than what you have with the original Medicare without a Medicare supplement plans. And additional coverage may be offered for dental, vision, hearing, and other services. How popular are Medicare Advantage plans? Well, take a look. 2007, 19% of Medicare beneficiaries had Medicare Advantage plans. Today, 54% last year, and I wouldn't be surprised if it's 60% or getting right up to 60%. People were going that way because it's less expensive. In most cases, it's less expensive. Not always, but at least the premium cost and everything going in is less expensive. So it's becoming more popular. Unlike Medigap plans, Medicare Advantage plans are guaranteed coverage. The issuer cannot at any time deny you coverage or charge you higher premiums based on health history or pre-existing conditions. Contrasting back to the Medigap plans we talked about, you've got that 6-month guaranteed time period, perhaps 1 year. If you start with a Medicare Advantage plan, you have 12 months maybe to get a Medigap if you switch back. After that, like I said, you're subject to underwriting. They can charge you a higher premium with a Medigap plan because of your health, or they can simply deny you totally. And if you've got cancer, if you have real cardiac problems, cardiovascular situations, and so forth, you're going to have a very difficult time getting a Medigap once you get past that 6-month period. But you always have that 6 months after you get Part B where they can't charge you any more than anybody else and they can't deny you. But with Medicare Advantage plans, you're always eligible regardless of your health. So you'll find that Medicare Advantage beneficiaries probably switch plans more frequently than original Medicare beneficiaries will switch plans. You contract with a Medicare Advantage plan for the calendar year. So once you're in it, you cannot drop or switch plans during the calendar year, except since 2021, they've also created this Medicare Advantage open enrollment period. So from January the 1st to March 31st, you can switch plans. Open enrollment every year is from October 15th through December 7th, when you can change Medicare Advantage plans, and you can also enroll in a new prescription drug plan, Part D, for the next year. But with Medicare Advantage, you also have this extra time period from January 1st to March 31st, where you can switch Medicare Advantage plans, or if you already have one, you could drop it and go back to original Medicare. Now, keep in mind, too, though, with Medicare Advantage plans, some providers may choose to leave or may be dropped during the calendar year. Very seldom is that going to happen. I mean, you can also have a provider that just decides during the middle of the year to not take Medicare at all, although most of them will wait till the end of the year. And true, with Medicare Advantage plans, they may do that too. But you may sign up with a Medicare Advantage plan because your doctor accepts it. There's always a possibility they could leave during the middle of the year, but it's not very likely to happen. So, comparing original Medicare to Medicare Advantage. Provider restrictions? None. With original Medicare, you can go to any doctor in the country who accepts Medicare. With a Medicare Advantage plan, there are a network of providers, and if you are allowed to go out of that network, you'll pay more. And that comes into the HMO and the PPO, which we'll look at. HMO, health maintenance organizations, there's a network of doctors, and you have to stay within that network. If you don't use a doctor in that network, be it a specialist or a primary, you'll pay whatever that doctor charges. With preferred provider organizations, you also have a network, and it's cheaper to stay in that network, but you do have the option to go out of the network, and part of it will be covered. So going out of the network doesn't cost you as much with a PPO as it would with an HMO. Also with original Medicare prior authorizations, uncommon, only 1 in 100 Medicare recipients needed some kind of prior authorization in 2023. Some of you may have read, but under the current administration, there is beginning this next year a trial with even original Medicare where they're going to require prior approval on some things, but they're kind of rather fancy things that most people don't get involved with, some kind of services, some kind of treatments. With Medicare Advantage, prior authorization is much more common. 2 per person were required in 2023. Why? Well, Medicare Advantage plans are private insurance companies. They're in that to make money. And you just think of how they might do that. What happens is every year Medicare will look at each county in the country. They'll look at their fee-for-service results, which means their original Medicare results. How much did they pay in Bexar County out of their pocket for people that had original Medicare in 2024? And they'll look at that, and they'll divide it by the number of people, and let's say it comes out a nice $14,400. I mean, some people, they'll pay $200 for the whole year, $300 for the year. Some people that pay tens, twenties, hundreds of $1,000s. But it comes out to $14,400. So what they say then is, divided by 12, that's $1,200 a month. So they tell all of the Medicare Advantage plans, you want to sell your plan or your plans in Bexar County, we, Medicare, will give you $1,200 a month for each person you sign up for a plan in this county. So it's a business. So they want to make money. So naturally, with Medicare Advantage plans, you're going to find that they'll be a little more restrictive, they'll ask more questions, and they may end up denying some things. But the truth is, and I have to be honest on this, even though the denial rate to start with, or the postponement rate is 13% higher, I think, with Medicare Advantage, most of the time, if people appeal that, then the Medicare Advantage plan will end up paying it. So the bottom line is denials with the Medicare Advantage plans are really only 1 or 2% more than original Medicare. The negative part of it, if you want to look at it, is simply the fact that you have to wait and you might be delayed on things. The maximum out-of-pocket limit, original Medicare, you have none. Like we said, with Medicare Advantage, it's $93.50 in 2025. If you reach that during the year, you pay nothing else. U.S. travel. Original Medicare covers you wherever you go in the United States. You can use it anywhere. But with Medicare Advantage, typically it only covers you for your specific area, although there are some regional plans as well. But normally it's not going to pay you all over the place. So if you decide you're going to spend half the year here and half the year in Minnesota, a Medicare Advantage plan might be a problem. Emergency care, though, even with Medicare Advantage, is covered anywhere in the country. Specialist referrals with original Medicare, not required, but it may be required from your primary care physician with Medicare Advantage. Premiums this year with original Medicare, you pay $185 for Part B, usually $0 for Part A. What you find with Medicare Advantage, you still pay that $185 for Part B, and the plan premiums are usually $0 or very low. In this part of in Texas, for the most part, you'll find an awful lot of $0 premiums for both PPOs and HMOs. You go to other parts of the country, particularly back east, you may find them more with premiums. But I point that out because there are people that sometimes say, I'm going to go with a Medicare Advantage plan because I won't have to pay Part B. Well, you do. Everybody has to pay Part B if you're on Medicare, so you're going to pay that anyway. Co-pays and co-insurance, original Medicare, the deductibles and co-insurance, including 20% on Part B. And with your Medicare Advantage, it varies based on whether the care is in-network or out. And I've got an example here in a minute of a couple plans that we'll look at. Compatibility with Medigap. With original Medicare, yes, you can buy a Medigap or a Medicare supplement. Not available with the Medicare Advantage plan. It's illegal for somebody to try to sell you a Medigap plan when you have Medicare Advantage, so it's not available. Doesn't mean you can't go buy a hospital indemnity plan, I guess, to pay what the plan may not pay for hospital stays. But basically, Medigap is not available. Vision, hearing, and dental, of course, like we said, is covered under Medicare Advantage plans. Many times, 97% of them are going to cover it. Original Medicare doesn't. It's separate. Drug coverage, you have to sign up with original Medicare for a Part D plan, so that's an extra expense. Most of the Medicare Advantage plans cover prescriptions, but it's not flexible, meaning with original Medicare, you can change Medicare Part D plans every year, and I do that every year or every other year, it seems like. But with Medicare Advantage plans, the only way you can change a prescription drug plan is by changing the entire Medicare Advantage plan. But to be honest, sometimes with some of the Medicare Advantage plans, you see better prescription coverage than what you can buy with the separate Part D plans because they kind of design them themselves. They have to follow certain of the same rules, but they can sometimes be a little better. Open enrollment, once again, I pointed that out, but just to keep in mind, October 15th through December 7th each year is what we call open enrollment. That applies to Part C Medicare Advantage plans and Part D prescription drug plans. I'll get friends who will call me now and then and say, I've got a Medicare supplement and I want to try a Medigap I want to change. Do I have to wait till the end of the year? Medigap plans, Medicare supplement plans, you can change or try to change anytime you want, January through December. But open enrollment applies to Part C and prescription drug plans, and like we said earlier, you've got that extra time in January where you can, to March 31st, where you can switch Medicare Advantage plans. Well, what about the HMO versus a PPO? Do I need a primary doctor? With an HMO, yes, you'll choose a primary doctor to manage all of your care, and he will refer you to specialists. It doesn't mean you might have a specialist that you like that knows has your same plan. You tell the doctor you want to go, he may let you go to that, not necessarily the one he wants, but you have to have approval from a primary care. With a PPO, you can go directly to any specialist or doctor that you prefer, in network or out of network. You can go to anyone. You don't have to go to a PCP in order to have them refer you to a specialist. You can do it on your own. Can I choose any doctor? Yes. With the PPO, you can. HMO, you have to stay within the plan's network except for emergencies. What will I pay? Usually, well, this is nationwide. Usually with an HMO, lower monthly cost. That's true. Less out-of-pocket spending. But with a PPO, you might have higher monthly costs, but more choices for your doctors. But again, as I said, in this part of the country, you can find both PPOs and HMOs for zero premiums pretty easy. You need referrals in your HMO. You don't need a referral with your PPO. You can see specialists without it. Can I get care outside of the network? With HMOs, only in emergencies, although emergency and urgent care coverage, you can have that throughout the U.S. if you need it. But with PPOs, you can go outside, but you'll pay more if you do. And you have emergency and urgent care coverage there as well. You look at the bottom left-hand corner, just for what it's worth, really in 2024, about 60% of Medicare Advantage beneficiaries were on HMOs. But again, part of that, I think, goes back east. You go back to New York, you go back to Connecticut, places like that. You'll find that more people there have Medicare Advantage plans and a higher proportion have HMOs. But all around the country, 60%. With few exceptions, like I said earlier, HMOs and PPOs in the counties that I've listed have no premium, but you still have to pay the Part B premium. And a few PPOs in these counties have premiums ranging from $18 to $142. Why did I put these up here? Simply to show that, as an example, in Bexar County, there are 30 HMOs this year. There are 27 PPOs. There are also 10 special needs plans. There are special needs plans that are developed for people that have diabetes problems, heart problems, cardiovascular. If they're dual eligible, if they're in a nursing home, they're primarily set up so that they make sure that the doctors are in those plans. There's a lot of them, and some good ones, I guess, that help these specific areas if you have problems in those areas. Bexar County, you see 30 HMOs, 27 PPOs. Gillespie, which is where Fredericksburg is, you have a lot of PPOs and HMOs. Kerr County, not as populated. You only have 4 HMOs, but you got 13 PPOs. Why so few HMOs? Because there are fewer doctors out there, and it's harder to get a group of them together, I guess, on one plan. Here's an example of an HMO and a PPO in Bexar County. I just picked Bexar Blue Cross Medicare Advantage and AARP PPO. These are just examples, just to show you how they work in contrast to original Medicare. No premium on either one. Out-of-pocket maximum of $47.50 on the Blue Cross HMO. With the Medicare Advantage, it's a PPO. The AARP, you got a $6,700 out-of-pocket limit. If you stay within the network, you go out of the network, you can go up to $10,100. You hit those levels, you don't pay anything for the rest of the year. Primary doctor, you see zero in both cases, but $25 out of network on the PPO. The specialist, $20 in network, 0 to 40, depending on who you go to. In network with the PPO, 75 otherwise. Come down to the hospital, here's where you can really get some cost involved. If you remember with original Medicare, you paid nothing for the first, we had a $1,676 payment, I'm sorry, but once you had a supplement or plan in, you'd end up paying nothing. But with an HMO, you'll pay $350 in this plan for the first 8 days and then nothing after that. With the PPO, it's a little higher. In fact, you see, if you go out of network with a PPO, you pay $5.95 a day for days 1 through 17. So the hospital costs can be more expensive. And like I say, you cannot have a Medicare supplement, but you perhaps could end up with an indemnity plan if you wanted. I don't think most people do that. Skilled nursing facility, you can see the difference here with the HMO. You pay nothing for days 1 through 20, and you pay $214 for 21 through 39, and then nothing after that. But you can bet yourself assured that that insurance company is going to do their best to get you out of there, and you're not going to stay there that long anyway. And then we see with the PPO, it's a little different price, and then some of the other things that you will pay. So let's take a situation as to how this would work. I haven't said at the beginning, but I'm not favoring either one of these. Some people will tell you that. Some people that have original Medicare, oh, I'd never do a Medicare Advantage plan because it's got to be the worst thing in the world. And you may talk to friends that do have that, but there are reasons that you might go one way. There are reasons you might want to go the other way. But let's say you had a serious accident or a heart attack. You had an ambulance trip. You got your primary care doctor probably involved, specialist. You have surgery, several days in the hospital, medicine during the hospital stay. And when you're in the hospital, by the way, Part B pays for your medicine, and also the medicine would be covered, however it's covered under your Medicare Advantage plan as well. Skilled nursing facility might come into play because you may have physical therapy, follow-up specialist visits. I don't know. We'll just guess that the total bills presented for all this stuff is $280,000. And Medicare, and let's say the Medicare Advantage insurer, if that were the case, they both say, we'll pay $50,000. Because those of you that are on Medicare may know how that works. You know, I end up with skin cancer every now and then with a basal cell, and I think I had to chop a piece off my ear and stitches here for something not too long ago, the basal cell stuff and a squamous. And I think I looked at my Medicare bills, and with all the biopsies and with everything else, the total cost was like $14,000. And Medicare said, we'll approve $3,900. So, you know, that's why I did this kind of example. What they charge as such is never what the insurance company agrees to pay. Let's say that was the situation here. If you have original Medicare and a Plan G, as long as all the providers accepted Medicare, which is most likely, you probably have no out-of-pocket medical expenses except for your Part B deductible. Probably paid 100%. Medicare Advantage plan, I think there's little doubt that you will, for the calendar year, have out-of-pocket medical expenses. You know, you will have them of at least $4,750 with that example we had on the HMO, or $6,700 or $10,100 with the PPO, because if you go through all this stuff, you'll probably be using out-of-network doctors as well during your recovery or surgery somewhere along the line. So what does that mean? Well, what's your cost for the original Medicare? You got the premium of $185 for Part B, so that's $2,220 for the year. You got a Part D deductible, you paid $257 if you had a Plan G. Let's say you paid $150 a month for the Plan G, you got an $1,800 payment. You got a Part D premium, maybe of $480, so $4,757. What do you have with the Medicare Advantage plan? Well, depending on whether you got the HMO or the PPO and you're out of whatever it is, you'll have more, like maybe $6,970 on the HMO, $8,970 on the PPO, $12,320 on the PPO. And keep in mind, at the end of the year, if this happened to happen and you're still recovering or going through some of this stuff, you roll over to January 1st, it starts all over. So you look at this and you'll say, well, it's probably better to have end up having the original Medicare and Part G. I won't say that. Number one, what you have to realize is that Part G premium particularly is going to go up every year. It may be $150 after a couple of years. I know people now with Plan Gs that are older that may be paying $350, $450 a month for that. Another thing to keep in mind is that all that's going to go up on the left, but on the Medicare Advantage plan, you know, hopefully you're not going to do this every year. Maybe it's just happened once every 10 years or once in your Medicare lifetime. So if that's the case, you know, even the 12,320 is there, but years going forward, it may not be. Only about 2% of people with Medicare Advantage plans each year go over the maximum out-of-pocket limit. So in the long run, you could be better off on the right, because hopefully you're not going to do this $12,000 every year, but everything on the left is going to go up. So there can be, you know, you got to balance it out. So it's not as bad as it looks like to start with. Well, which plan is right for you? Do you want the flexibility of original Medicare, or is the potential for lower upfront cost and extra benefits with Medicare Advantage more attractive? Do you have chronic conditions, or do you anticipate high medical costs? If so, maybe there's a reason to look at original Medicare. Can you afford a Medigap plan, the Medicare supplement, to supplement the original Medicare? Or would an out-of-pocket limit with a Medicare Advantage plan be more suitable for your budget? Do you want or feel you need to keep specific doctors and specialists who might be out of network with a Medicare Advantage plan? Because one of the things you want to do if you decide to go with a Medicare Advantage plan, find out if your doctors accept that plan. Some of them are limited. Some of them will accept most anything, even if they don't accept your plan to start with. There are some doctors that say, well, no, but I'll accept that if you want to do it, and I'll sign up. Do you travel frequently within the United States, and do you want to have medical coverage anywhere that Medicare is accepted? If that's the case, people that spend a half a year in one part of the country and a half a year somewhere else, original Medicare might be the better way to go. Also, I just threw this in here. Do you anticipate the Mayo Clinic or MD Anderson to be in your future? Because for what it's worth, Mayo Clinic doesn't accept Medicare Advantage plans anymore, except to have some kind of contract ongoing with United Healthcare, but they don't. MD Anderson, they accept some of them, but I read recently, for whatever reason, they have dropped Blue Cross Blue Shield of Texas. So these are things to think about with Medicare Advantage plans. The largest insurers, obviously, United Healthcare, Humana, Blue Cross Blue Shield, do about 61% of the work or of the business for Medicare Advantage plans. Average commissions, for what it's worth, for Medicare Advantage plans, those commissions are set by CMS, the Center for Medicare Services. And the commissions are paid, though, by the insurance companies, but the brokers who sell them can get $626 when they sign you up for a Medicare Advantage plan, and then each year it renews after that another $313. Medigap plans are set by the individual insurance companies. They're going to vary, but they said the average this last year was, you know, like 20% of the premium. So if you got a premium of whatever that works out to, the $1,500, what's that, $125 a month, then, you know, the premium $125, so then they'll pay $300 and $312. So you can see that the commission is much higher with the Medicare Advantage plans. And again, I'm not against Medicare Advantage plans, but you think back to a couple of years ago with the Joe Namath and William Shatner, and you still see it on TV. All the advertisements are primarily for Medicare Advantage plans. They make more money with them. There are some major changes coming in 2026, particularly for Medicare Advantage plans. If you happen to have a United Healthcare plan, it's going to affect them most, but they are actually dropping companies this next year. In other words, they're going to quit. You'll be notified if you have one or you have friends that have one by at least the 1st of October, and it's going to tell you that plan is going away. And if it's going, and not all of them, there's just some of them. I think it's about 1 million people in the country, which is only about 3% of the people that have Medicare Advantage plans are going to be hit by this. But if that's the case, you have to pay attention, because you'll either have to switch. They're not going to cross you over like they sometimes do. When a plan quits, they'll cross you over to another one automatically if you don't, they don't hear from you. But they're going to drop you if you don't sign up for another Medicare Advantage plan or go to the original Medicare. And that happens, you got to take care of it by the 1st of January. One of the things about it is that because of that, as I understand it, the people that are being dropped will have an opportunity to go to Medicare Advantage, Medicare, original Medicare, and buy a Medicare supplement. regardless of health, regardless of their condition. I do understand, though, that I think people will have to buy, they can't buy an N if this happens to them. You can buy a G. The only way you can buy an F is if you were born before 1955, but G is the best one, I think, anyway. The reason that is because G, you pay the $257 deductible, but you're going to find that the premium is more than $257 a year less for a G than it is for an F, so it's wiser to go with a G. I can give you an example of how you can do this. Some people get on original Medicare, and I've had friends that do this, and all of a sudden they're paying $400 a year because they're getting older and older. If you're healthy, you can switch, and I don't mind saying that I did. I've done 3 times. When I first went in Medicare 15 years ago, so I give you my age right there, didn't I? I went to United Healthcare, which, because it's all, and when I went to United Healthcare, I had a Plan F, and it cost me $115 a month. 7 or 8 years later, I said, or 9 years later, I said the premium was up to $220. So I went to USAA and went to a Plan G, and the premium was $145 to start with. After 3 years with USAA on a Plan G, my premium was up to $194. So 2 years ago, I ended up switching to a Humana Plan G, and I went back to $145. And now I'm at $160. And so being 80 years old, that's not too bad. Now, if I have health problems, I can't do that. Another thing to think of a lot of times, you can't go from a Medicare Advantage back to original Medicare and a supplement if you're not healthy. But a lot of people may start with a Medicare Advantage, a Medicare supplement with the Medigap, and when the Medigap gets too high and they feel like they can't afford it, then fine, they can switch to a Medicare Advantage plan. You can always go that route. One of the things I do say is take your time when you choose. Don't be pushed by salespeople. Maybe there are salespeople in here, I don't know. And some of them are good, even if they stick with a particular company. But my thought always is if you can find somebody who represents a lot of companies, they can broker you with a lot of companies, they can find you the best. Also, if you can find somebody who can sell both Medicare Advantage and original Medicare. I didn't put any list in here or whatever it is, but for what it's worth, you go online. There are several companies. There's one called MedicareSchool.com, which is actually in Overland Park, Kansas, but they're nationwide. They sell both, and they help people. I actually went to a company called MedigapSeminars.org, which is out of Florida, and they're the ones that switched me to this Humana plan because they said, which do you want? Here's the reasons for this. Here's the reasons for this. I said, I want Medicare supplement. And they ended up talking to me about it, and they went through it, and they said, here's a good plan. Did they find one cheaper? Yeah. There's a company called ACE, which is part of Chubb, which is the biggest insurance in the company, that had just started, and I could have got a $125 premium there. But their advice, and I agree, was the fact that they're brand new, so they got new people coming in, which means that particular group of people, you're probably going to find the premium is going to go up very quickly after that. So I went with the Humana plan, but you can switch. But don't be pushed. Take your time. Have somebody help you who can tell you what the advantages are here and that and work with your situation. Okay. I put some helpful numbers here to reach a benefits counselor who can help you with Medicare, answer some of these questions, or any other resources in the community. And Brett had talked about ACOG to start with. I put some numbers up here that you can call the intake number, and you can end up getting a benefits counselor that can call you back and talk to you. I don't volunteer and do that anymore, but I did it for 15 years. And then they switched things a little bit when COVID came along, and I stopped. But I still do some presentations. So that's my story, and I'm sticking to it. And I will be around and try to stay around to the end of this if people want to ask me questions.
All right. Thank you, Jim. How many of you feel like you're Medicare experts now? Raise your hand.